More than a month after the war in Gaza broke out, all the focus of this war so far boils down to one salient symbol. The Al-Shifa hospital in the western part of Gaza City. It is now not just the largest hospital complex in the Gaza Strip, it is also doubling up as a fast-growing refugee camp. But the most important allegation against this premises is that it's being used by Hamas as a safe haven, a hideout of sorts. Israel has accused Hamas of using Al-Shifa as a vast human shield above the main command center of the terror outfit. Israeli defense forces have from time to time released evidence which indicates that Hamas leadership has been using this premises as a command and control center. Just in this past week, the Israeli army has been laying the groundwork for justifying a potential attack on the hospital. There is, according to Israel, terror activity occurring beneath and around the hospital. Israel frames this as a war crime by Hamas. 2 weeks ago, the Israeli Defense Forces put out videos which purportedly showed Hamas commanders directing the fighting against Israel from inside this compound. They also showed a large storehouse of arms and ammunition. The army also revealed that entry to the underground command center is through a number of tunnels, both close to the hospital and inside the hospital walls. The army has also announced that Hamas is using the hospital's electricity supply for itself. An IDF spokesman publicized recordings from interrogations of terrorists in which they describe how Hamas terrorists hide themselves inside the hospital and move people and equipment in civilian ambulances. And that is because Hamas knows that Al-Shifa is a safe place which will not be bombed. There was also a recording of a conversation with an official in the Gazan health system who admits that Hamas is keeping more than 500,000 liters of fuel underneath the hospital. Israel claims that Hamas has rebuffed the offer of electricity, knowing that keeping Al-Shifa as a safe haven is perhaps more important than having surgeries performed there to save lives. A surprising number of Israeli physicians are also well acquainted with Al-Shifa. Since 2009, a delegation of doctors from Physicians for Human Rights has been visiting Al-Shifa every month and performing surgeries. They're also conducting consultations with patients and training some of the doctors there. These delegations to Gaza are essentially comprised of Arab doctors. The monthly visits have a dual goal. One is to assist the local medical staff with some of the relatively complicated surgeries, and two, to train the Gazan doctors to perform surgeries by themselves. On ordinary days, there used to be more than 500 doctors of various nationalities working at Al-Shifa, but now there are no more than 200 doctors because of the war. Al-Shifa is a large hospital. Above the ground, it stretches across dozens of acres. Currently, it is much more than a hospital, having become a huge refugee camp. Since this war began, tens of thousands of Palestinians have fled to Al-Shifa to find shelter from Israeli strikes. Reuters, in fact, reported last week that refugees have filled the hospital grounds and are staying in makeshift tents in waiting rooms and hallways. 2 days later, the military detonated illuminating shells above the hospital. Apparently, it was a signal to the masses there to leave. This is not the first time that Al-Shifa is the center of fighting in Gaza. In January of 2009, during Operation Cast Lead, Israel had accused Hamas of taking over the hospital and hiding its men in the building. In July 2014, when Operation Protective Edge was happening, top Hamas commanders were reportedly hiding there. And in the present war, this is the biggest decision that Israel has to make: whether the costs to pay in attacking a hospital full of patients and civilians is worth it compared to the high-value targets that it suspects are hiding inside there. Al-Shifa is owned and operated by the Palestinian Health Ministry. It was built during the British period when Egypt conquered the Gaza Strip in 1948 and had control of it till 1967. Al-Shifa became Gaza's main medical center. Since Israel took control of Gaza in 1967, Al-Shifa has seen improvements. In fact, in the mid-1980s, Israel spent millions trying to renovate Al-Shifa as a flagship. Al-Shifa is considered the largest hospital in Gaza with a vast amount of space, over 500 beds. It provides 60 to 70% of all the health services in Gaza. Gaza has about 30-odd hospitals, but many of them are much tiny compared to Al-Shifa. The hospital is made up of several wings. It has a surgical division, an internal medicine wing, a maternity wing. It also has outpatient departments, pathology, and an imaging department. The surgical wing includes 12 large operating theaters. Bombing a hospital is an action that is considered extreme. It has happened very rarely. It happened during Second World War and thereafter very, very rarely. There has to be a clear justification for doing so. It clearly goes against the established conventions that govern the rules of war, including the Geneva Convention. The rules of war prohibit any direct attack on non-combatants or civilians, no matter what the circumstances are. Civilians can only be considered as collateral damage, and that too under exceptional circumstances. In the last days of the Iraq War, there were many civilian casualties in places like Mosul and Fallujah. US forces had faced a lot of flack for the civilian loss of life back then. Israel may be winning the actual war on the ground, militarily speaking, but the war is not fought just on the battlefield. In the battle of international perception, Israel may be risking breaking the camel's back if it decides to go ahead and bomb the Al-Shifa hospital.